Welcome to Seeing Sepsis, a video presented by Joy Koniski, DSD, for Royal Springs Healthcare and Rehab. Today's objectives include understanding the early warning signs of sepsis, learning to implement the, Seeing Sepsis 100 Feet Toolkit, and developing knowledge of additional infection and sepsis prevention resources. The stats on sepsis are alarming. Over 500 people die each day, and 1.7 million are diagnosed annually. Sepsis is the #1 reason nursing home residents are admitted to hospitals. Sepsis is the body's extreme response to an infection. It is a life-threatening medical emergency. Without timely treatment, it can rapidly lead to tissue damage, organ failure, and death. Sepsis pathophysiology is complex. Sepsis is a life-threatening organ dysfunction caused by a dysregulated host response to infection. As Roland J. Fairbanks, MD/MS, states, sepsis is a sneaky disease. Almost any infection can lead to sepsis, and 80% of cases occur outside the hospital. Early recognition is critical. SIRS, or Systemic Inflammatory Response Syndrome, indicates the body is fighting. QSOFA, or Quick Sepsis-Related Organ Failure Assessment, suggests organ failure is starting. Your sepsis protocol instructs you to act fast. Sepsis occurs when chemicals released into the bloodstream to fight an infection trigger inflammatory responses throughout the body, potentially damaging vital organs. When the body fails to fight the infection effectively, a chemical overload can lead to blood pressure drops, confusion, and organ failure. This is the act fast moment. The body's response to inflammatory mediators includes vasodilation, capillary leak, and blood clotting. These factors can decrease blood flow to organs and extremities. Sepsis starts as an infection that enters the bloodstream, multiplying rapidly. The body's immune response sends white blood cells, causing extreme inflammation. The pathophysiology of sepsis illustrates the progression from pathogen invasion and immune response through decreased blood flow to organs, metabolic acidosis, septic shock, and multi-organ failure. Time is tissue. What you do or do not do in the early hours of sepsis makes all the difference for the resident's outcome. Over 80% of sepsis begins outside the hospital walls. Most adults who develop sepsis have a health condition that increases their risk. Common infectious organisms include E. coli and Staph aureus. For our residents, sepsis occurs when a localized infection, like a UTI, gets into the bloodstream. Common sources include wounds, pneumonia, and gastroenteritis. Be alert to signs and symptoms of sepsis: fever, extreme pain, clammy skin, confusion, shortness of breath, high heart rate, and low blood pressure. You can help by being a resident advocate. A change in behavior or the resident simply being not right can be an early sign. Clues often appear in vital signs. Act fast with a nursing assessment. Look for a suspected infection plus 2 or more of the following: abnormal temperature, pulse, blood pressure, respiratory rate, or altered mental status. The acronym SEPSIS helps remember the key signs: shivering/fever, extreme pain, pale/clammy skin, sleepy/confusion, I feel like I might die, and shortness of breath. We will use the Sepsis Toolkit, similar to the McGear tool, for early recognition and alert escalation. Follow the red flag algorithm for 2 or more signs. Once signs are present, the critical next step is to follow the established sepsis protocol immediately. This page is blank to transition to the next step, which details the sepsis protocol actions. If the resident remains in the skilled nursing facility, we must follow the doctor's orders. This may include labs, cultures, establishing IV access for fluids, and administering antibiotics. Monitor closely for worsening signs like low urine output or low blood pressure, despite fluids. Manage pain and fever. Keep the family informed and adjust the care plan as needed. An ID badge will be provided to help with quick identification and reminder of the sepsis protocol steps. Here is a sample progress note template. Be sure to document the resident's symptoms, sepsis alert activation, physician notification via SBAR, treatment initiated, and family updates. To activate the sepsis protocol in PCC, obtain the doctor's order. Go to the resident's profile, click the Order tab, select Batch Order, search Sepsis, and then click and save. The Sepsis Champion team plays a vital role in coordinating the early identification and management of sepsis. This slide provides a moment to reflect on the importance of your role in recognizing and responding to sepsis. Please continue to seek out resources and opportunities to know more about sepsis and effective management strategies. This concludes our video on seeing sepsis.